Deadly childhood diseases such as measles and pertussis are on the rise in Tigray following the destruction of more than 80% of its health system and the comprehensive siege that has denied the entry of basics such as vaccinations. Deputy Head for Bureau of Health Dr. Riesaya says reports coming from some districts across Tigray indicate that such diseases might be occurring as epidemics in recent times.
Now in Tigray there are a lot of cases that pop up because of this system and destruction of the system and because of the siege. For example, we can see more than 10 waradas of Tigray. We show an epidemic of measles. There were reports from more than 10 waradas. And then there are also pertussis cases. We can see from 2 spots, hospitals, health facilities, like, for example, the report from Al Hospital and Aida Referral Hospital told us more than 56 children are affected by pertussis. And we are also getting acute flaccid paralysis, possibly polio, where the international community is solid enough to eradicate from the world. But we are seeing, though we can confirm because of the siege and the destruction, but we are seeing polio-like cases. We call them acute flaccid paralysis.
The deputy head states that vaccinations for children in Tigray have been completely stopped for 6 months since May, leading to an increased mortality of children under 5.
It's been more than 6 months that the Tigray's children are not getting vaccine at all. This is so sad. The mortality rate for under 5 is currently 59 per 1,000 lives. When we compare this with the past, it was like before the war, for example, it was 30 per 1,000. The major cause for, if you take, for example, the under 5 mortality, and then most of them, the cause are, one, this prenatal asphyxia, prematurity, and vaccine-preventable diseases like pertussis, measles, diarrhea, pneumonia, and others. This means, for example, if you take the prenatal asphyxia and the prematurity, this was prevented by undergoing antenatal care, postnatal care, and intervening if there is any medical needs during that period of time. And those pertussis and diarrhea disease and pneumonia, what have you, which we call them vaccine preventable disease, by vaccinated child, we can prevent those diseases. But here in Tigray, there is no vaccine.
Dr. Ray says years of hard work has been reversed by the war, and diseases that had once been controlled are yet again posing a threat to the community.
For the start of the war, we were almost controlled majority of this vaccine preventable disease. It was like a 1 or 2 case reports, and it was, as I said, an exemplary for the country. It was a benchmark, and particularly for vaccine, it becomes a culture of the society.
The deputy head warns diseases that had once been eradicated with a tremendous amount of effort can yet again devastate the world if the international community fails to act on the situation in Tigray.
Then cases can be built up into outbreaks, epidemics, and finally it can be pandemics. So the international community have no any information about what in Tigray is happening and what the situation, what the disease status, and what have you. So I urge the international community to open his eyes and even concern about himself that this region might be the source of pandemics if we can't intervene as early as possible.